gentle. Gently. Nothing, oh my god, I repeat myself, nothing should go inside there, not even water.
I found peace in your violence. Can't tell me there's no point in.
Hi guys, hi beautiful people, welcome back to my YouTube channel. If you're new here, my name is Kamlotzy and I'm a content creator based in Abuja. And if you're not new here, you're very much welcome back to the channel. So today's video is going to be very personal, and today's video is for all my girlies. If you're a lady, if you're a girl, if you're a woman, this video is for you. Now if you're not a girl, please just scroll. This video is not for you. This video, I was contemplating if I should do it because I'm going to be I'm going to go in depth into feminine hygiene, feminine health. Try as much as I can not to be vulgar, but it is what it is at the end of the day. So in today's video, we're going to be talking about feminine hygiene. In this video, I'll also be talking about feminine health. I'm also going to be talking about the tips and tricks to elevate your feminine hygiene, and also the do's and don'ts for your feminine health and hygiene. If you're coming from a household where these things were not talked about, maybe while growing up, or you had a lot of challenges about just talking about, knowing about what to do about your feminine health and hygiene, in this video I got you covered. So this video is going to be grouped into parts just for easy understanding, explanation, and so on and so forth. So if that's what you're looking for in this video, please don't forget to give me a thumbs up, please subscribe, and let's get right into the video. So first, let's talk about the anatomy of the ladies part. So you have the labia minora, you have the labia majora, you have the clitoris, you have the mom pubis. I'm going to leave an image of this thing somewhere so you will see it. You have the mom's pubis, you have the urethra opening, you have the vaginal opening. All this together is called the vulva. Now the vulva is basically the external female reproductive part, which is made up of 6 things, right? Which is the labia minora, majora, mom's pubis, clitoris, urethra opening, and vaginal opening. This is the external reproductive organ of a lady or of a woman. Now you have the internal reproductive organ, which starting from the vaginal opening, which leads to the vagina properly. Then you have the cervix, then you have the uterus, then you have the fallopian tube, then you have the ovaries. I need to clear the anatomy, so when I go into breaking down everything, you would understand. I just hope you follow. Now I want you to know that the female external reproductive organ, which is collectively called the vulva, different variations. They are all beautiful. There are different variations in size, in shape, in color. Even the labias have different variations. There are different shapes of the labias. Lady X labia minora can be totally different from Lady Z's labia minora. They are just different varieties. So not because your own is a certain kind of way you feel like you're abnormal. It is normal to have different variations of your vulva, right? So 50 to 60% of women may have what is called outy labia, which is basically the labia minora like protruding out of the labia majora. Now in this case, the minora is protruding out of the majora. So some women may think, oh, this is abnormal. No, it is normal. It is normal for some women. This is the way they were created. This is the way they were born. So now, after this video, I want you to take a mirror and examine yourself. Examine your vulva. Know what the color looks like. Know what the shape looks like. Know what the size looks like. Know what, just examine to know what your God-given vulva looks like. Also know what the skin looks like. Know what the texture looks like. How your labias look like. Know how your hair grows. Know the normal for you. Like your own, know the normal, right? I want you to take a mirror, go down there and examine, know everything about you. It's not a taboo. So the reason for this self-examination and the reason to know what your normal God-given vulva looks like is just so that when there is an abnormality, you would be aware. So when there is, maybe there's a swelling, maybe there is change in texture, maybe there is rashes, maybe there's just an abnormal deformity, or there's just something from the normal, you know, because you've done your self-examination, you will be aware of it. Do you get? Also, this will also help you in knowing how to clean properly, knowing how to clean yourself properly. So if you know how your own is, you will know how to clean it. So let's talk about health now. So if you are 25 years and above, right? If you are sexually active, if you are sexually active but you're not yet 25 years, now if you are 25 years, you are not sexually, if you're 25 years and above, that's what I'm talking about now, you're not sexually active, I want you, as far as you're a woman, I want you to get a good OBGYN. Now, when I say a good OBGYN, which is obstetrics and gynecologist, I don't mean, now let me break it down. I don't mean get a good family physician, no. I don't mean get a good medical doctor. That's family medical doctor. These OBGYN are medical doctors who are specialized in women health and female reproductive care. Now, OBGYN is a branch of medicine, so they are strictly for women. Women reproductive, everything about women when it comes to their reproduction and everything. So that's why I said get a good OBGYN. When I say good, I mean someone you are comfortable with, someone you can open up to. If you're not comfortable with a man, there are women too in that field. So get the one you are comfortable with, that knows his job and that is good at it. There are different specialties in medicine, so this particular one, please look out for them and get a good one. So let's talk about vaccination. Now, if you're a female, if you're a woman, if you're a female above 9 years, you're not sexually active, now you need to get HPV vaccine, which is human papillomavirus vaccine. Now, there are strands of this virus that are responsible for different cancers. They're responsible for cervical cancer and a lot of cancer. So this vaccine is most effective and encouraged to be given to females and males between 11 to 12 years. So if you have young daughters and young sons, please vaccinate them. Vaccinate your children. So there are basically different strands of this virus, but there's a certain strands that are responsible for a lot of cancers. Now, if you're sexually active and you haven't gotten this vaccine, that is why I said you need to have a good OBGYN. So speak to them and they will tell you what to do. You cannot be going around and be doing a lot of things and not be checking yourself. Health is wealth. So let's talk about pap smear tests. Now, this is a test used in screening for cervical cancer and HPV virus. A woman, between 21 years and above, you need to be getting pap smear every 3 years. This is just for screening of cervical cancer. When I say get a pap smear test, whether as a lady you are sexually active or not, you are meant to be getting a pap smear test every 3 years. So the next thing we're looking at is cleansing and shower routine. So now for the cleansing of your vulva, you are meant to cleanse your mom's pubis, your labia, so the labia minora, the labia majora, the urethra, the clitoris. These are where you are meant to clean, right? These are where you are meant to. What should you use to clean your vulva? Water is fine. If you're someone that just uses water, you're perfectly fine. But if you are not comfortable with just using water, you can use a gentle cleanser. Now, when I say gentle cleanser, I mean cleanser that contains no soap, no fragrance, no essential oil, and cleanser that just have minimal ingredients in them. Example of product I would recommend for cleaning down there: Dove unscented soap, CeraVe hydrating cleanser, Cetaphil cleanser, Dr. Brown unscented soap. I will look, not the one with peppermint, the unscented, Neutrogena ultra gentle cleanser. These cleansers have a pH close to the skin, they are less irritating, and they are very gentle on that area. Please avoid feminine hygiene products. It is a no. Most of this feminine hygiene product contains fragrance, they contain essential oil, they contain a lot of ingredients. So now you see the vaginal opening that leads to the vagina. Nothing, oh my god, I repeat myself, nothing should go inside there, not even water. Nothing should go into your vagina. Why? This is because your vagina is self-cleansing, meaning your vagina cleans itself. God has made it like that, to be cleaning itself. When I say cleaning, I mean around. I did not say put it inside. Let's talk about how to cleanse the vulva. So you can cleanse your vulva using your fingers, or you can use a soft washcloth. I did not say hard, I said soft. The skin down there is extremely sensitive. Your fingers, please make sure that your hands are clean. And then for the soft washcloth, please make sure that cloth or the washcloth you'll be using down there is specifically for down there. Now, to clean, make sure you open apart your labia. So your labia minora, your labia majora, make sure you open there, go in between the crevice and do a scrub. Gentle gently, the skin around there is very sensitive. Do a scrub motion between your labia majora and your thigh, between the labia minora and labia majora, between the labia minora and the clitoris, and please just make sure you do a scrub motion from down to up, not up to down, because if you're doing up to down, you're moving whatever into the vaginal opening. When you're doing this scrub motion, so you're either using water or you're using your gentle cleanser. Under cleaning, please, you not only clean your vulva, you also clean your anus. So always put this at the back of your head. You clean the front before the back. You don't clean your anus before you clean your vulva. You clean your vulva before you clean your anus, so that you don't take bacteria from your anus to your vulva, right? Also, for cleaning of the anus, you clean from down to up. So down to up movement for the anus. So you're cleaning away from the vaginal opening. It's because your anus has a lot of bacteria. So if you move from up to down movement. So the next thing, let's talk about smell, discharge, and period. So for smell, as a woman, you have a kind of personal smell. It is totally normal. You aren't supposed to smell like candy. You aren't supposed to smell like flowers. You aren't supposed to smell like pineapple. You aren't supposed to smell like chocolate. You are not meant to smell like that. You have a human smell. There is just this human smell, and it is normal. It is fine. You're not supposed to smell like all these things. You aren't supposed to eat tropical fruits. You aren't supposed to put anything inside there for you to smell a certain kind of way. No, you just have a human smell, which is normal. It's totally fine. That is how our maker has made us to be. It is fine. I said previously in the video, your vagina is self-cleansing, and this cleansing brings about discharge. It is fine as a human to have discharge. We all have discharge. As far as you're a lady, you're a woman, you're a girl that has reached puberty, you will have discharge, and it is totally fine. It is normal. So this self-cleansing mechanism is to keep the bacteria in the vagina at bay. Now in your vagina, you have good bacteria and you have bad bacteria. The good bacteria checkmate the bad bacteria. So that's why when they say put all these things, you're just trying to destroy the ecosystem, the balance between these two people. And once the bad guys overshadow the good guys, there is problem. They just scatter the whole pH balance of that place, and there is just a lot of problem. And I also want you to note that every woman or every lady has different types of smell down there. So know what your normal smells like. Once your vagina is healthy, know what it smells like, so that if there's any turn off, or if there's any off smell, you will know. If there's any foul smell, you will know that no, this is not what it normally smells when I am fine. Every healthy vagina has different smells. A lady A smell will be different from lady B smell. That is it. It is just normal. If I would describe the smell of the lady's part, it will range from smelling like a musky to sour to metallic. They are just different types of smell. Now also note that your smell will also change during your hormonal phases. As your cycle is going, your smell is also changing, right? So when you know the normal, when you start smelling fishy, bad, foul smell, then you will now know that no, this is a sign of concern, and you will go get yourself treated. Periods. So when you are on your periods, you can use tampons, you can use pad, anyone is fine. And then this pad comes according to the heaviness of your flow. So there are pads that will say heavy, there are pads that is medium, there are pads that is light. So you also need to know what your flow is like. There are people that have heavy flow. You can't be having heavy flow and you're going to buy a pad that is saying light flow. Make it make sense. So buy pads or buy tampons according to the kind of flow you have. You can also wear your pads according to the days of your flow. So like most times from day 1 to day 2, some people day 3 heavy flow, so you can stick with the pads that tackle heavy flow. Then day 3, day 4, day 5 medium flow, you can stick with medium flow pads. Then day 4, 5, 6, you can now deal with the light flow. Ideally, you should change your pads every 4 hours. But if you can't, please, twice in a day. You should wear your pad morning and night flow. Once you're on your period and you're a lady, please have 1 or 2 pads in your bag. And please, those days you're going to be on your period, always have handy wet wipes, unscented. Just because if you're going to go out and then maybe something happens and you need to change, using tissue to just clean down there before changing will not effectively take out the blood. There are some blood that could be on the hairs around there. So these wet wipes will just make you to clean properly, take out everything, every blood, clotted or unclotted around the area before changing your pads. Period pains are normal. Yeah, it's normal, but just the period pains that you just need to take pain meds and you're fine. But once you start having those excruciating pain that makes you bedridden, you can literally not do anything, please go and see a doctor. It is not normal to be having pain that you'll be rolling on the floor, crying, shouting, screaming. It is not normal. Please go and see a doctor. That's why I said have a good OBGYN. During your periods, please make sure you take adequate care of yourself and also adequate rest. If you're someone that loves going to the gym, please, when you're in the gym, please don't lift heavy during your periods. Please try and do light exercise. You can just take walks. You can just maybe just use the treadmill, not like sprints, please. Just normal, simple walk on the treadmill, even normal walk on the road. Or you can do nothing. You can just decide to sleep in your bed and absolutely do nothing. It is fine. Adequate rest during your periods. So the next thing we'll be looking at is panties/underwears. Please wear new, clean, fresh pants every day. Please don't repeat your pants. You shouldn't be wearing the pants you use today, you wear it tomorrow. No. Now, the best pants you can buy or the best pants you should wear is cotton pants. Please leave all those lace. They are fine. They are very fine. I'm not even going to lie. They are very, very beautiful. They are very pretty. Those nylon, polyester, please leave them. I know they are fine, especially if this lace don't even have like where your pants should stay. If they are not cotton, please, you have no business with that pants, or you just get a cotton pant in general. I was growing up, that's what my mother always buy for me, but I was like, why is this man always buying me ugly pants? Because cotton pants are not so fine. Now that I'm at this stage of my life, I understand why she used to buy those pants for me. Now I think they are better, fine, cute cotton pants out there in the market now. But when I was small, it was not fine. They were ugly. But now they are cute, fine, pretty cotton pants. Please gravitate to cotton pants. Leave all those things. Reason being that cotton pants are absorbable. Women, we constantly release, we have discharge, right? These cotton pants soak in this discharge. If you're a cotton pants wearer, you know what I'm talking about. Most times when you take out your pants, it is dry. Like there is nothing, because your cotton pants absorb your discharge. Wearing the lace, the nylon, you always be feeling a certain kind of way down there. Cotton pants let your V breathe, makes down there like breathable. Avoid wearing tight pants. That place needs to breathe, so please avoid wearing tight pants. And I'll also tell you another reason when we get to another part of this video. Secondly, please avoid wet pants or wet clothes in general. Please avoid anything wet down there. Make sure your pants are well dried before wearing them, especially after every workout section. When you come out from the gym, you're sweating down there, please take out everything, including the pants. Take everything out. Please avoid anything wet around there. Also, after urinating, please cultivate the habit of cleaning before wearing your pants. So after urinating, please cultivate the habit of using tissue or using unscented wipes to clean down there. So like I said, down to up movement, never up to down movement. Please, against the vagina opening. So maybe you go to defecate, and please, if you want to clean, also down to up movement, never up to down movement, so you don't send in bacteria from your anus to your vagina. So please, I want you to take notes. Your vagina is naturally acidic, so as the discharge your vagina is also releasing, it is also acidic. Now, over a period of time, when you use this, especially when you use black pants, over a period of time, you will notice that there is a certain kind of area on your pants. If you bleach the pants like that, it is normal. I want you, why I'm saying this thing, so that you know that it is normal. So now when you start seeing those bleach signs on your pants, you start panicking like there's something wrong with you. No. And please, once in a while, please iron the part that touches your vagina, so the place your pad will normally stay. If you can't iron the whole pan, just iron that place. That place your pad will stay. Please iron it once in a while. So let's talk about nutrition. Learn to drink water. At least make sure you're taking in 4 to 5 liters of water every single day. Not only for your feminine health, for your skin, and for your total health in general. Secondly, diet is very, very important when it comes to feminine health. I want you to note, and so also your health. But for feminine health, the diet that is most effective for us is your fruits and vegetables, and your prebiotic and probiotic foods are very, very important for feminine health. So make sure you are taking in prebiotic foods and probiotic foods. I'm going to leave example of these foods on the screen. Just make sure you're taking them. This will help you with your feminine health. I'm seeing this thing of people saying eat pineapples if you want to smell and taste sweet down there. Please don't fall scam of all these things. Like I said, you're not meant to smell or taste like candy down there. If you smell and taste like candy, you should be worried. Like, you should literally start running to the hospital to ask what is wrong with you. So please eat pineapple just because of the health benefits. Yeah, eat pineapple because you love pineapple. I mean, pineapple is sweet. Yeah. There are also supplements that are also good for feminine health, which are supplements that contain prebiotic and probiotic. they are also good. But if you can afford them, yes, why not get supplements that contain prebiotic and probiotic? Are they necessary? Not really. If you can't afford them, please just opt for your prebiotic and probiotic foods. The next thing we'll be talking about is shaving and ingrown hair. To avoid ingrown hairs, before you shave and after you shave, learn to exfoliate. So for exfoliation, you could use physical exfoliation or chemical exfoliation. So physical exfoliation, which is body scrubs, body polish, body scrubs like sugar scrub, like salt scrub, is fine. Or you could use chemical exfoliation, which is AHA or BHA. But for ingrown hairs, I will tell you to use salicylic acid. That is the best chemical exfoliation for ingrown hairs, in the sense that salicylic acid goes into the pores and take out everything from the pores. So it is going to be very effective for ingrown hairs. Opt for salicylic acid rather than glycolic acid. Glycolic acid will also help, but salicylic acid will do more for your ingrown hairs compared to glycolic acid. I will exfoliate a day to shaving, so I won't exfoliate the day I want to shave. No, because that place is very sensitive, so you don't want to do everything that same day. Now after shaving, I will not exfoliate today. I will either exfoliate tomorrow or the day after tomorrow. Where you're exfoliating is basically where you have hairs. So where you have hair, mom's pubis, the labia majora, and probably the inner thigh. Yeah, the inner thigh, that's where you have hair. So that is where you should exfoliate. Please don't go and put anything inside your. For hair remover, please avoid shaving. Shaving is a no-no for me. I learned the hard way. I don't shave anymore. When I say shaving, I mean razor. That's using shaving stick to shave. That is what I mean. Please avoid it. Why I hate shaving and why I am against shaving is because shaving brings a lot of ingrown hairs. Shaving brings a lot of discoloration. If you don't shave properly, you will enjoy yourself. You will cut yourself. You will enjoy yourself. So please avoid shaving. But if you love shaving, because there are people that enjoy shaving, that's fine. Please, if you're going to be shaving, one, make sure you don't shave on dry hair. Shave in the direction of your hair growth. If you shave against it, my darling, you are looking for trouble. So what I would recommend, or what I use, is either waxing or using hair remover. If you can't afford waxing, please opt for hair remover. I'm going to put the one I use on the screen. Very, very effective, gets the job done. You don't have fear of cutting yourself. You just put it and you're good to go and you are washing it. But please be careful so it doesn't get into your vagina opening. After removing the hairs around there, please make sure you moisturize that area using you could use light oils like aloe vera gel, just to make sure, most effectively aloe vera gel, just to soothing, because aloe vera gel has a soothing effect. Please use aloe vera gel around there to make it soothing and calm. Some people that are just very, very, very prone to having ingrown hairs, like even after doing everything I've said in this video, they will still have 1 or 2 ingrown hairs. Please, you need to get ingrown hairs treatment. The first one is the touch ingrown hair. You have the topical ingrown hair. You have the Vanish PFB for ingrown hairs, and you also have the First Aid ingrown hair pads. Please use them the next day or even a day after you have shaved down there. Avoid wearing tight pants, as this can compress the hair and also bring about ingrown hairs. So not a fan of shaving. It's fine, totally fine. Just make sure you trim so that you don't have excessive hair, because anywhere there's excessive hair and is enclosed, it brings about smell. Just like your underarm, if you don't shave your underarm, you most likely would start having smell. That's the same way with down there. And also when you're on your periods, the blood gets clotted around these hairs if they are so long. When they get trapped in this hair, if not properly cleaned, you can have a certain kind of smell. So yes guys, this comes to the conclusion of this video. If you found this video very helpful, please don't forget to give me a thumbs up. Please subscribe. Please hit the notification bell to get when next I post my next video. If you have any question, this is what I'm passionate about. Don't forget to leave it in the comment section. I'll be there to answer your questions. I'll be there to attend to them, and I'll give you effective answer. Thank you so much for watching, and I will see you in my next one. Bye. I love you.
Room 2110, I knocked on the door at the penthouse suite, 'cause I needed more from you.